हेलो एवरीवन। our today's टॉपिक इज़ न्यूरो डेवलपमेंटल डिसऑर्डर्स। आज की इस वीडियो में हम न्यूरो डेवलपमेंटल डिसऑर्डर्स के बारे में पढ़ेंगे और हम जानेंगे कि न्यूरो डेवलपमेंटल डिसऑर्डर्स किस तरह से इफ़ेक्ट करते हैं और इनके क्या ट्रीटमेंट्स हैं और कौन कौन से न्यूरो डेवलपमेंटल डिसऑर्डर्स हैं। सो लेट्स स्टार्ट इट। सो न्यूरो डेवलपमेंटल डिसऑर्डर्स बेसिकली होते क्या हैं? न्यूरो डेवलपमेंटल डिसऑर्डर्स और a group of conditions with onset in the developmental period. The disorder typically manifests early in development, often before the child enters grade school, and are characterized by developmental deficit that produce impairment of personal, social, academic, or occupational functioning. The range of developmental deficit varies from very specific limitation of learning or control of excessive functions to global impairment of social skills or intelligence. So neurodevelopmental disorder basically group of conditions है जिसका onset early developmental period है, even before child enters in grade school. A person with neurodevelopmental disorders will be deficit in personal, social, academic, or occupational functioning. The DSM-5 neurodevelopmental disorder work group determined that number 1, intellectual disabilities, intellectual developmental disorder. Second, communication disorders. Third, childhood onset fluency disorder, also called stuttering. Number 4, autism spectrum disorder. Fifth, attention deficit hyperactivity disorder. 6, other specified attention deficit hyperactivity disorders, unspecified attention deficit hyperactivity disorder, and specific learning disorders. So we will discuss one by one all the disorders, but today's we will discuss only one disorder, that is intellectual disability. Intellectual disabilities is a disorder with onset during the developmental period that includes both intellectual and adaptive functioning, deficit in conceptual, social and practical domains. इंटेलेक्चुअल डिसेबिलिटी के जो ऑनसेट पीरियड है वो डेवलपमेंटल पीरियड है। किसी पर्सन को इंटेलेक्चुअल डिसेबिलिटी डायग्नोज करने के लिए दो चीज़ें बहुत ज़रूरी हैं, यानी वो पर्सन डेफिसिट होना चाहिए इंटेलेक्चुअल और एडाप्टिव फंक्शनिंग दोनों में। DSM-5 में 3 क्राइटेरियाज दिए गए हैं जो किसी पर्सन को इंटेलेक्चुअल डिसेबल डायग्नोज करने के लिए ज़रूरी होने चाहिए। सबसे पहला जो क्राइटेरिया है वो ये है कि a deficit in intellectual functioning such as reasoning, problem solving, planning, abstract thinking, judgment, academic learning and learning from experience, confirmed by both clinical assessment and individualized standardized intelligence testing. पहला क्राइटेरिया है deficit in intellectual functioning. पर्सन की इंटेलेक्चुअल फंक्शनिंग्स में प्रॉब्लम होनी चाहिए। इंटेलेक्चुअल फंक्शंस कौन से होते हैं? हमारी रीजनिंग, प्रॉब्लम सॉल्विंग, प्लानिंग, एब्स्ट्रैक्ट थिंकिंग, जजमेंट, एकेडमिक लर्निंग एंड लर्निंग फ्रॉम एक्सपीरियंसेस। An intellectual deficit must be confirmed by both clinical assessment and individualized standardized intelligence testing. बहुत सारे साइकोलॉजिकल टेस्ट हैं जो इंटेलिजेंस को मेजर करने के लिए, जो प्रॉब्लम सॉल्विंग को, रीजनिंग को, प्लानिंग को, एब्स्ट्रैक्ट थिंकिंग को, जजमेंट को, एकेडमिक लर्निंग को मेजर करने के लिए यूज़ किए जाते हैं। सो साइकोलॉजिस्ट बाकायदा टेस्ट अप्लाई करने के बाद डायग्नोस करता है कि पर्सन इंटेलेक्चुअल डिसेबल है या नहीं। सेकेंड क्राइटेरिया है deficit in adaptive functioning that result in failure to meet developmental and socio-cultural standards for personal independence and social responsibility without ongoing support. The adaptive deficit limit functioning in one or more activities of daily life such as communication, social participation and independent living across multi-environment such as home, school, work and community. The person will be deficit in adaptive functioning. Adaptive functioning कौन सी होती हैं? तमाम सोशल एक्टिविटीज़ जिनमें आप कम्युनिकेशन करते हो, अपनी रिस्पॉन्सिबिलिटीज़ को ऑन करते हो, आप सोसाइटी के अकॉर्डिंग अपने नॉर्म्स, अपने कल्चर के अकॉर्डिंग अपनी ज़िंदगी गुजारते हो। जबकि पर्सन जो इंटेलेक्चुअल डिसेबल होगा उसकी ये तमाम एक्टिविटीज़ में प्रॉब्लम होगी, वो किसी की हेल्प के बिना कहीं आ जा नहीं सकेगा, किसी से बात नहीं कर सकेगा, उसकी कम्युनिकेशन बहुत कम होगी, उसकी सोशल लाइफ बहुत ही ज़्यादा कम होगी, उसको प्रॉब्लम होगी स्कूल, वर्क प्लेस में, कम्युनिटी में, होम में, हर जगह वो बग़ैर किसी की हेल्प के नहीं रह सकेगा। और जो तीसरा क्राइटेरिया है वो ये है कि ऑनसेट ऑफ इंटेलेक्चुअल एंड अडॉप्टिव डेफिसिट ड्यूरिंग द डेवलपमेंटल पीरियड, यानी कि इंटेलेक्चुअल और एडॉप्टिव डेफिसिट उसका ऑनसेट डेवलपमेंटल पीरियड, यानी बहुत स्टार्टिंग में ही ये चीज़ें स्टार्ट हो जाएंगी। Okay. In the United States, intellectual disability affects around 1 in 10 families. Males are more likely to receive a diagnosis of intellectual disability. Now, what are the causes? Basically, the causes of intellectual disability is unknown. Typically, however, the condition develops due to injury, disease, or certain brain conditions. Any condition that impacts the brain and begins before the age of 18 years, even before birth, can cause intellectual disability. However, intellectual disability can also develop later in childhood or adolescence due to conditions that cause brain damage. Some common causes of intellectual disability include certain genetic conditions such as Down syndrome. Down syndrome is a condition in which a person has an extra chromosome. Chromosomes are small packages of genes in the body. They determine how baby's body forms and function as it grows during pregnancy and after birth. Usually एक बेबी के क्रोमोसोम्स की तादाद 46 होती है, जबकि डाउन सिंड्रोम में एक एक्स्ट्रा कॉपी होती है और ये एक्स्ट्रा कॉपी क्रोमोसोम नंबर 21 की होती है, इसलिए इसे ट्राइसोमी 21 भी कहा जाता है। सो डाउन सिंड्रोम जिन बच्चों में होता है उनमें इंटेलेक्चुअल डिसेबिलिटी हो सकती है। नेक्स्ट है फेनिलकेटोनुरिया। ये एक इनहेरिटेड डिसऑर्डर है दैट कॉज अ बिल्डअप ऑफ फेनिलीन, एक अमाइनो एसिड है जो कि ब्लड में बनता है, जिसकी वजह से मेंटल रिटार्डेशन, बिहेवियरल प्रॉब्लम्स, मूवमेंट प्रॉब्लम्स, सीजर्स एंड डिलेड डेवलपमेंट हो जाती है। नेक्स्ट है फ्रेजाइल एक्स सिंड्रोम। फ्रेजाइल एक्स सिंड्रोम इज जेनेटिक डिसऑर्डर that caused by changes in genes. The gene name is FMR1. The FMR1 gene makes a protein that called FMRP that is needed for brain development. And people with Fragile X syndrome do not make this protein. That is why the Fragile X syndrome can cause intellectual disability. Cognition anomalies are brain malformations. Brain malformations are a condition in which brain has not formed properly. Some type of infections also can cause intellectual disabilities, such as meningitis. Meningitis is inflammation in the outer membrane, covering membrane of the brain and spinal cord that can cause intellectual disability. Next is measles. Measles is viral contagious disease that cause fever, runny nose, red eyes, and cough, etc. All these symptoms, and it can be spread through one droplet of coughing or sneezing easily. Or whooping cough. Exposure to toxins such as mercury, serious head injury, stroke, maternal disease such as rubella. Rubella is a contagious disease. It's also called German measles, and person who get rubella sometimes shows no symptom and sometimes gets mild symptoms such as low fever, sore throat, and rashes that starts usually from face and spread on the whole body. During pregnancy, if a mother gets rubella, it has serious impact on the newborn and it can cause intellectual disability also. Next is drug use or infection during pregnancy, problems at birth such as insufficient oxygenation, extreme malnutrition, and insufficient medical care. To diagnose intellectual disability, a doctor will perform several tests. to assess the person's intellectual and adaptive functioning. Tests that may include an IQ test, a score of 70 to 75 may indicate intellectual disability. Interviews with the individual and others who have observed their adaptive functioning, that is their conceptual, social, and practical functioning also, such as family members or teachers, whether or not someone has the skills necessary to live independently. A doctor and psychologist also can perform general medical tests, neurological tests, psychological tests, special education tests, hearing, speech, and vision tests. Physical therapy evaluations. Intellectual disability tends to develop and cause noticeable symptoms before the age of 18 years. ट्रीटमेंट एंड मैनेजमेंट. इंटेलेक्चुअल डिसेबिलिटी के लिए ट्रीटमेंट और मैनेजमेंट क्या है? पहली चीज़ तो ये कि इंटेलेक्चुअल डिसेबिलिटी को मुकम्मल तौर पे ठीक नहीं किया जा सकता, क्योंकि ये लाइफ लॉन्ग कंडीशन है और इस डिसेबिलिटी के लिए कोई भी ट्रीटमेंट अभी तक तो नहीं है. But most people learn to improve their functioning over time. Receiving early ongoing interventions can often improve functioning, thereby allow someone to thrive. Most treatment plans to intellectual disability focus on the person's strengths, needs, support, need to functions, additional conditions. Many services exist to help people with intellectual disability and their families get the support they needed. Most of these services allow someone with intellectual disability to function normally in society. Someone's diagnosis typically determines which services and protection of rights, such as special education or home or community services, they are eligible to receive under federal or national law. It also usually helps determine which supportive services they may need. There are some supportive services also. Supportive services include early interventions that work to identify intellectual disability in infants and toddlers, special education and academic support, such as individual education plans which are available in the US. Under federal law, for free to every child with intellectual disability transition, services that help people with intellectual disability transition to adulthood after high school day, programs, vocational programs such as job coaching or skill learning, housing, option, case managers to help coordinate services and ensure that an individual receives proper care, psychological or psychiatric services, speech and language pathology or audiology services, therapeutic, recreation, rehabilitation, counseling, adopted equipment or assistive technology. Family members, caregivers, friends, co-workers and community members can also provide additional support to people with intellectual disability with proper support and treatment. Most people with intellectual disability are capable of achieving successful production roles in their communities. However, how well someone is able to cope and function with intellectual disability is also dependent on the severity of their condition and any other underlying genetic or medical conditions they'll have. So our topic is complete. Please do like, share and subscribe my YouTube channel.